This year, for my topic, I chose to study orthopedic surgery and sports medicine. So my quote is, "We are at our very best and we are happiest when we are fully engaged in work we enjoy on the journey towards the goal we've established for ourselves. It gives meaning to our time off and comfort to our sleep. It makes everything else worthwhile." And basically, this quote I can relate to because in the future I'd want to be doing something that I'm really passionate about and not just go through life doing things that I don't really have the desire to do. Just some background. So orthopedic surgery consists of injuries involving the musculoskeletal system, which includes bones, muscles, ligaments, tendons, nerves. Some conditions that they treat include ACL, meniscus injuries, fractures and breaks, tendon damage, and spine damage also. Within orthopedic surgery, there are different subspecialties that doctors can specialize in, one being sports medicine. And sports medicine is a subspecialty that deals with athletes' physical fitness and the treatment and prevention of injuries. So it's basically going more into depth over injuries that are related to athletics, which I can relate to because as being an athlete, I've been injured many times myself. So it's I like to learn more about this topic because I know what others are going through, and I know that you'd want to get back and play as soon as possible. Some research that I've conducted. First, more about ACL injuries, which is, so the ACL, which is the anterior cruciate ligament, stabilizes the knee when pivoting and twisting. And basically I learned more about how women are more susceptible to having an ACL injury, which was really interesting to me because I didn't think that gender could affect how prone you are to an injury. So basically, some aspects that surgeons have found out is that women have smaller or different size bone structure, or can also deal with the hormone estrogen. So basically, estrogen receptor sites increase collagen content, which make it more likely to have an ACL tear. Next, I've researched arthroscopic hip surgery, which is a minimally invasive surgical procedure where an arthroscope is inserted into the joint through a small incision. So basically, through these surgeries, you're allowed to, it decreases time after the surgery, so you're able to heal faster, and it's a less invasive procedure, so it's not as cutting through bone and stuff like that. And this was really interesting to me because my mentor actually specializes in these types of surgeries, so I'm hoping to maybe be able to watch one of these being performed. I also conducted more research on sports medicine, and many surgeons who specialize in sports medicine work with sports teams ranging from the high school to professional level, and throughout all my interviews I found this to be really exact because many of them are sports teams physicians for different levels of teams. And I also learned more about, there's a type of sports medicine research being done that is called a sports metrics program, which basically involves weightlifting, stretching, and different forms of jumping that allows or decreases the percentage of forces on the knee, so you're less prone to injury. For interviews, the first person I interviewed was Dr. Catherine Coiner, and she is an orthopedic surgeon specialized in sports medicine who works for UT Southwestern. She was also a college athlete, and so she really knew what it was like to manage her time throughout schooling and medical school after college. and she was a team physician for many of the sports teams at Duke University. And many of her patients today are athletes, and she performs about 8 surgeries a week and also shows like medical students like different procedures throughout the week. My next interview was with Dr. Shane Miller, who's a pediatric sports medicine physician. And instead of being a surgeon, he's just a physician. So he's the one who like diagnoses patients' injuries, but he doesn't actually perform the actual surgery. Since he's in the pediatric field, he works with children. So there's different cases with children because you have to take into account like growth plates. Then you don't want to injure growth plates so that kids are like, you don't want kids to have like a fatal injury due to that. And he also teaches students in the clinic, and he really emphasized that sports medicine is a team event because he works with other physicians in his hospital that he works at to create like treatment plans for different patients. My next interview was with Dr. Don Buford, who is not affiliated with the hospitals, and he has his own private practice, which I found to be interesting because there are different benefits but yet downfalls to that. One benefit being that he gets to create his own work hours and has like more vacation days and gets to decide which surgeries he wants to perform. But there's also like more of the paperwork side to it, and people are now being affiliated with hospitals, that's more common today. And he played professional baseball for the Baltimore Orioles, so he knows like what it's like to be a professional athlete and go through like the injuries. So he really wanted to help others through this field. He also specializes in minimally invasive shoulder and knee surgery, along with ACL and meniscus repairs. My next interview was with Dr. Stephen Michelson, who's a general orthopedic surgeon, so he does many procedures, kids and adults both, and he has many diverse work days. Sometimes he's just in the clinic diagnosing patients, and other days he can have multiple surgeries. He's a previous mentor for ISM student last year, and he also told me that through medical school, you get to experience the different types of surgery, and going in, he wanted to be a trauma surgeon, but he switched to orthopedic surgery because he felt like it fit his skills better. And one other interesting thing that he told me was that after med school is a very long process, so he's saying like after college, even if you want to like take a year off before starting med school to experience new things, that would be a good idea, which I found very interesting. And then my last interview was with Dr. William Robertson, who I've chosen to be my mentor. He's an orthopedic surgeon specialized in sports medicine, and he is a head team physician for the Dallas Stars. So he works alongside them and helps the athletes through injuries and things like that. And then something like common throughout all my interviews that I found out was most of them played a sport in college, and I've recently committed to play sand volleyball at the University of Southern California. So I will have to manage my time like they did throughout college and then going into med school after that. For my original work, I will be working with my mentor alongside the stars to determine whether hip range of motion affects the FMS screen, and basically FMS stands for functional movement screen. It's a series of 7 tests that allows you to determine what areas are more prone to injury and like things that you may need to work on and like build strength. So basically I will be seeing if hip range of motion affects like athletic performance of the stars. Just overall, I'm really excited to work with my mentor this year and learn more about sports medicine, orthopedic surgery, and because I feel like I can relate to this field very well, being an athlete myself, so I'm excited to learn more throughout the year.